Hello everyone, this is Jennifer Jimenez. I am a master's prepared nurse practitioner who is duly certified in family practice and psychiatric mental health. I am in the DMP program, and my project is about supporting the psychiatric mental health nurse practitioners transition from education to practice. I would like to give thanks to my faculty director, Dr. Francis Vlasis, and my mentor on site is Mari Deval-Mackey. And I'm going to go over my poster with you guys so that you can know what my project is about. On the top left-hand side, you'll see objectives. Objectives for this project is to develop and design an interprofessional clinical and didactic curriculum based on mentorship and self-reflection, to support and educate psychiatric mental health nurse practitioners who are also known to be PMHNPs and novice PMHNPs in their first year of practice, to monitor the level of self-reported confidence and readiness and evaluate advancement in their role as practitioners and professionals. Going to the left of the slide, you'll see problem identification. The transition time between staff nursing and advanced practice nursing is an opportune time for mentoring nurses. Nursing education strives to prepare nurses to meet competencies that will help them prepare for practice. National Board Certification for Psych NPs provides a baseline foundation for graduates to enter advanced practice. However, there's a significant gap that is noted between being a registered nurse and a nurse practitioner. The need and feasibility for this project entailed doing a SWOT, which is an organizational assessment, including strengths, weaknesses, opportunities, and threats. And we did analysis of the organization, where I work, and where Mari is my boss and my mentor, and development of a project plan. This is an evidence-based project. Discussion relating to PMHNPs is largely based on the progression of PMHNP education, which includes areas of development such as defining and expanding the workforce, competency-based learning, mentorship, and postgraduate training. Specifically, when talking about defining and expanding the workforce, is just the development of the role as we've gone from CNS to PMHNP to lifetime PMHNP, and incorporating dual diagnosis, substance abuse, therapy, and care of children in our role. While there are individual case studies and reports about postgraduate training, the only systemic review that I could find in all of the literature only cited 5 articles that related information about transitioning from being an RN to an APRN. This is a testament to the lack of evidence that's been disseminated regarding this topic, which is what prompted me to try to do this. So the project plan, I have a pre-implementation self-survey, which I adapted from a variety of other tools, including interprofessional competencies and analysis of the term self-reflection and self-efficacy. So all of the participants will take the self-survey before we implement the project. The project includes 16 weeks of the following: 12 weeks of didactic teaching, which will include case review, prescribing pearls, special topics that are specific to psychiatric mental health nursing. It will also include clinical time, an assigned mentor, which is me, interprofessional collaboration with social workers, nurses, therapists, psychiatrists, internal medicine, and other psych NPs, and a rotating experience, which includes inpatient psych, outpatient psych, intensive outpatient therapy, and consultation services on a medical floor. Beyond the 12 weeks of teaching that are didactic, there will also be other weeks where we will do case studies, journal club, reflective learning, and discussion, give people opportunities to discuss cases that we've seen and discuss opportunities in collaborative care and in taking care of those patients. After the 16 weeks of the project, The participants will take the same survey post-implementation, looking at the same things, concepts with interprofessional competencies, self-efficacy and confidence, and then the pre and post surveys are going to be compared, and we will hope to see an increased level of self-reported confidence and advancement in their role as practitioners and professionals. The implications for practice are pretty big and broad. This project opens conversation to postgraduate training in the transition from education to practice as a PMHNP. It paves the future for our NPs, and it has the ability to set forth a standard for training, educating, and transitioning NPs who are newly graduated. And it can be implemented in my own setting, but also disseminate the findings to others so that the prototype can be developed for implementation across the nation, defining and refining the role of the PMHNP. The references are listed below, and I hope you guys enjoyed my presentation.